Hi, I'm Dr. Ryma, a gastroenterologist based here in Melbourne. Today we're talking about family history and bowel cancer and what it means for you, your screening and your health. Now this is a really common question I get in clinic. My mum had bowel cancer, does that mean I'm going to get it too? The answer is not necessarily, but it does mean we need to take a closer look at your risk. Because while most cancers of bowel cancer happen in people with no family history at all, having a close relative who's had it does increase your risk. The good news is, if we know that risk early, we can screen earlier, monitor more closely, and catch changes before they become serious. So let's go through how we assess risk, who needs earlier screening, and what do you need to do if bowel cancer runs in your family. So what counts as a family history? In this case, we're mainly looking at your first-degree relatives. That means your parents, siblings, or children. We're especially interested if any of them were diagnosed with bowel cancer under the age of 55, or if 2 or more relatives were diagnosed at any age. The younger the cancer was diagnosed, the more suspicious we are that there could be a hereditary factor involved. So if your dad was diagnosed with bowel cancer at 80, your risk might be slightly increased, but probably not enough to change your screening schedule. But if your mum was diagnosed at 48, that's a different story, and we'll want to start screening earlier than the general population. So what are the risk categories? The Cancer Council and NHMRC guidelines break it down into 3 main categories. Category 1, or average risk. This is for people with no family history or just one first-degree relative diagnosed over the age of 60. If you're in this group, you're considered to be at near or slightly above average risk, just like the general population. We recommend you start screening with the fecal occult blood testing, or FOBT test. That's the stool test every 2 years from the age of 45 to 74 as part of the National Bowel Cancer Screening Program. If your test is negative, you just repeat it in 2 years. This test is free, sent to you in the post and done at home, and is very quick and simple to do. And if it's positive, we follow up with a colonoscopy. Category 2, or moderate risk. This is for people who have 1 first-degree relative diagnosed before age 60, or 2 first-degree relatives diagnosed at any age, or 1 first-degree and 1 or more second-degree relatives, such as grandparents, aunts or uncles, diagnosed at any age. This group has about a 2 to 4 times higher risk of bowel cancer compared to the general population. In this case, we don't just rely on the stool test. We recommend having a screening colonoscopy every 5 years, starting at age 50 or 10 years before the age your youngest relatives were diagnosed, whichever comes first. So if your dad was diagnosed at 45, we'd want to start screening you at 35. Colonoscopy is more invasive than the FOBT, yes, but it also allows us to detect and remove polyps before they become cancer. And depending on what we find, we'll usually repeat the colonoscopy every 5 years. Category 3, high risk. This is where we start looking at hereditary syndromes such as Lynch syndrome or familial adenomatous polyposis, also called FAP. People in this group usually have multiple family members diagnosed with bowel cancer, including 2 first-degree relatives and 1 second-degree relative, with at least 1 diagnosed before age 50, or 2 first-degree relatives and 2 or more second-degree relatives with colorectal cancer diagnosed at any age, or 3 or more first-degree relatives with bowel cancer diagnosed at any age. Or hereditary syndromes may also be present in people with a history of combinations of bowel, endometrial, and other related cancers. This group is rare, less than 5% of all bowel cancers, but the risk is much higher. If your family history looks like it might fall into this category, we often refer you to a familial cancer centre for genetic testing and counselling. So if you're hearing words like Lynch or FAP in your family, or multiple people have bowel cancer young, then get it checked out. The earlier we know, the better we can monitor and protect your health. Even if you don't have a genetic syndrome, if you have a strong family history and fall into this high-risk category 3, you'll need a colonoscopy every 5 years, starting at 10 years younger than the earliest age of diagnosis of bowel cancer in the first-degree relative, or at age 40, whichever is earlier, until the age of 74. What if I'm not sure about my family history? That's a really common situation. Maybe your parents passed away young, or you're estranged from, or you don't know your birth family, or no one in the family talks about health stuff. If that's the case, ask questions if you can. Chat to your relatives, especially your older ones, and find out who had cancer, what kind, and what age. It might feel awkward, but it's information that could potentially save your life. And if it's still unclear, speak to your GP. They can help piece together a risk profile and decide whether you need earlier or more frequent screening. What if I'm under 45 and have no symptoms? Even if you feel well, if you have a strong family history, you may need screening before age 45. Remember, bowel cancer often develops silently with no symptoms in the early stages. That's why we screen to catch things before they become dangerous. So if your GP recommends a colonoscopy in your 40s or even your 30s, it's not overkill. It's smart, proactive healthcare. And if you don't meet the high-risk criteria but you're still worried, that's okay too. Talk it through. You might be eligible for screening outside the national program, and your GP or specialist can help guide you. So for a quick summary, let's recap. 1 first-degree relative diagnosed under 60 or 2 with bowel cancer, you may need colonoscopy from age 50 every 5 years. No strong family history? Stick with the FOBT every 2 years from 45 to 74. Concerned about a genetic syndrome like Lynch or FAP? See your GP for a referral to a familial cancer centre. And no matter your age, if you develop symptoms like blood in your stool, changes in bowel habits, or unexplained weight loss, see your GP. Don't wait. So final thoughts. Having a family history of bowel cancer does not mean you'll get bowel cancer, but it does mean we need to be alert, proactive, and start screening early. Bowel cancer is highly treatable, even preventable when caught early. So if there's a history in your family, don't ignore it. Use that knowledge to your advantage. Thanks for watching. If this video helped clarify things for you, feel free to like, subscribe, and share it with your loved ones, especially the ones who say, "I feel fine, I don't need a test." Sometimes a little information is the nudge they need. Take care, and don't forget to look after your gut.